Good morning. My name is Brooke Lakin, and I'm coming to you today to present the second part of our academic course content. And this is talking about the second competency from the NLN core competencies for nurse educators. And this is facilitate learner development and socialization. So, learner development is an ongoing event. It's not isolated to one classroom, one PowerPoint, one exam. We have these students in our grasp 2.5 years now, and sometimes even longer if they stay with us for some graduate work. So, it's an ongoing event. Our learners are diverse. We have learners that are from different parts of the country, sometimes different parts of the world. We have different backgrounds, we've got different learning styles. So, things that we need to take into consideration when we are facilitating learning is who we're actually teaching. Um, Also, academic advising, we don't necessarily do a lot of that at UT because we have our awesome student services. But we do, counsel students on maybe graduate work or things of that nature. So things need to be, in the forefront of your mind about academic advising, just how to instruct the student, how to lead them, answer questions. The next part is learning styles. So how we can be aware of learning styles and how that affects our teaching styles as well. Critical thinking and practices that will encourage critical thinking and also to facilitate that as well. It's easy for students to want to come in, listen to a lecture, and leave. It's really hard to get them to critically think and participate. So those are some other things that us as facilitators can educate them on, encourage them to do, and lead them in that practice. Thinking about professional identity, and then also lastly is civility. So diverse learners, some topics that the NLN brings up for diverse learning is English as an additional language. So we do at UT have students who speak multiple languages, and at other facilities you may have, formerly known as ESL, now English as an additional language, taking into consideration some of the advantages, but also possibly some of the roadblocks that this can cause, especially when it comes to, translating as a teacher when you use slang or acronyms or things that are regional. They may not understand that. They may not understand the slang. And then also in written text, it may be difficult for them to take what is written in English on an exam, translate it into their language, and then also get the meaning behind that. So those learners are amazing to work with because you can see the intelligence that they have and the vast knowledge of culture, but also being aware that this could cause a hindrance whenever it comes to written and spoken language. We do at UT also have group of veterans that come through our program. They're very active in the ROTC. Some of them have served actually in combat and have been deployed. So those learners can be an amazing asset to your classroom when talking about life experiences, but also to be aware that there may be some things that could cause some mental and emotional trauma, different things that we come into contact with them as nursing students. So to be sensitive and aware of the needs of those learners. Our LGBTQ students, making sure that they're taken care of and recognized as well. Trying not to just single that group of students out because there's all students that have special and specific needs. But just to be, encourage the faculty to be sensitive, to be aware of those students, and then also your accelerated BSN students. That group of students is, if you've ever worked with them, they are typically your adult learners. They are second career, second degree. Some of them are older than your traditional aged BSN students. So they come to the classroom with life experience. They come to the classroom with life knowledge. This program is also heavy in academic workload. This program is condensed down. And so that is also something that you need to keep into consideration when thinking about the diversity of all of our learners. Things that you can research on your own to try to help you shape your your technique as an instructor, as and facilitator of learning. Um, Looking at Kolb's experiential learning theory, that's one of the big learning style, um, I guess, research that the NLN uses. Kolb and Kolb in their 2005 work talks about learning cycles and the preferences that are developed among the modes of learning. So I encourage you guys to just, if you take a little bit extra time, want to look up the Kolb's ELT and be aware of that. Also we know that there are different learning styles that are, involve psychosocial, psychomotor. It involves verbal teaching, uh, presentations that are aesthetically pleasing to the eye. Also, getting people involved in note taking. Some people learn better in group work. So there's many different teaching styles that you can incorporate into your classroom rather than just the typical traditional lecture where the student is not actively engaged. Some students really like that style though. I think that they like to come in, be taught what they need to know. And so we do run into that. I think those are pretty common complaints. They just want to come in, get the material, and leave. And it doesn't really engage their critical thinking. So that's where we need that motivation to influence our students to be actively engaged in the classroom, be prepared when they come to class. We use the mastery learning model in our hands-on lab setting. They come in, they're prepared, and then we put them straight to work. So that they're having to critically think through these courses, through these modules, through the mastery learning, and also in our hands-on physical assessment class as well. They come in prepared, and they come in and they're they're tactically engaged in the learning that they're doing. In the classroom, it seems like it is more difficult to do that, but we have some amazing instructors that are excellent at flipped learning, doing different types of group work. So I would encourage you to reach out if you wanted to get some ideas. Reach out to some different instructors in our college. Ask them if you can come and sit in on their lecture, sit in on their class. Ask them where they get ideas. There's a really good book that I included in this module. It's called Bonks. It's by Bonk, and it's made for online learning. But you can take, there's 100 different ideas that you can take and use as a different type of teaching tool. So I'd encourage you to look at that. I included the link in this module. It's a really good resource. I reference it often to get ideas for different types of activities that I can do, especially in an online setting, but you can absolutely translate that to having some online activities outside of the classroom. We also want to be facilitators of critical thinking. Again, like I said before on the previous slide, there's some different types of teaching styles. You've got simulation, which we are excellent at, especially with our SIM team and the staff and faculty that work in that area. Critical thinking activities, when you talk about flipped learning, that can be um, including a lot of critical thinking activities. Some other things that we use: unfolding case studies. We use care planning activities, especially when you have a virtual simulation and you use the care planning. I also use that to teach care planning. So, they have to critically think through that activity because no one is sitting there telling them step by step. They bring their work into the classroom and we go through it. So, as you think about things that you'd like to learn about, incorporate in your classroom, ask around, ask what people are using. There's so many databases for different types of simulations, alternative teaching methods. One of them that I like to reference is actually in this the NLN Core Competency for Nurse Educators, and it's by I cannot pronounce the name, but I will put the link to some of these resources on this module. Another thing that we want to think about too, and we're thinking about facilitating the critical thinking, is thinking about the next generation NCLEX style and how that they're going to be testing, incorporating that into the classroom, getting the students to think outside the box, more of an unfolding case study, especially as our NCLEX models continue to change. We want to stay in front of that so that our students will be prepared. Lastly, just want to touch on civility. If there is incivility in the classroom from students, faculty, those type of environments do not encourage critical thinking, because when students critically think and put themselves in a vulnerable place in an activity, and civility is not respected, then that can cause a complete hindrance to your learning environment. So, a good practice is to set ground rules from the very beginning of the class, ground rules from each session, ground rules for each activity, so that the students are aware that incivility will not be tolerated in the classroom. Civility is throwing a wet blanket on a really good learning experience. So, as faculty, we need to be able to mediate if there is incivility, call it to the attention, pull the students out if you need to get administration involved. But we need to be big encouragers of civility in the classroom, especially between students as peers, but also between faculty in the classroom. Being on the same page, being prepared, and encouraging each faculty member to the students. Never talking about a faculty member to the students in a negative way, critiquing or criticizing activities that the primary educator or primary faculty member of that class has the students doing. Just to be really to foster civility between faculty to the students, and that creates an environment of encouragement and unity, and it will also encourage and motivate the students to continue that in their role as students, and then hopefully they'll bring civility into their role as a floor nurse so they can work as a team member. And they've learned all this just from modeling that type of behavior from a faculty role. It's really important to create safe learning spaces to facilitate learner development and then socialization. Need for further research. There are gaps in this. A lot of gaps that are noted in the literature are talking about researching different types of programs, how students have different needs, especially students that come from a BSN going straight into an advanced role, or advanced student role, such as a DNP program, PhD, with that lack of that master's degree level. There's a lack of research on that. There's also lack of research when talking about how the different types of learning models apply to different learning styles. So I would encourage you, if this is something that you're interested in, look at the extra references and then look at the space in which you're working in and teaching in, and see how you can be an innovator as a faculty member to encourage civility and also promote the socialization of the classroom, students to the classroom, and you as a faculty member. So thank you for listening to this PowerPoint, and move on into the quiz.